We've been concerned that the reform is going too far and too fast, so we've argued the government should slow down, and particularly with GP commissioning consortia, should allow the consortia to go ahead only when they're clearly ready to do so. They've got the GP leadership, they've got the management support, and they're ready to take on control of what will be eventually £60 billion of public money and can be held accountable for that. We think those messages are getting home. The listening exercise is a really good opportunity to reiterate our concerns and to try and influence government policy.
So do you think we will end up with a phased approach?
I think it's highly likely we'll end up with a phased approach because nobody wants these reforms to fail, least of all the government. It makes a lot of sense to say for those consortia that are ready to go, let's do so as quickly as possible from April 2013. For those that aren't quite ready, let's allow another year or so. And for others, it may take a little longer. What we also must do, therefore, is hang on to the expertise that the primary care trusts have had, and the formation of the clusters is a good stepping stone towards doing that.
Could you explain to us the make or buy suggestion?
The issue with make or buy is that GPs are first and foremost providers of primary care to their patients. The government is now saying, as well as being providers of primary care, we want you to take control of the budget to commission hospital care and other services for your patients. That creates a real opportunity, if we get it right, for GPs to be able to allocate more money to their practices so they can work more effectively with community nursing services, with hospital-based specialists, to provide more services directly in the community, and therefore to use hospitals only when that's the clinically appropriate thing to do. The risk in all of that is that GPs have conflicts of interest. Some people are worried they might start to line their own pockets if they control budgets. So there needs to be proper governance of how those decisions to make or to buy are taken to avoid those risks, but also to take advantage of that real opportunity to provide better patient care, more care closer to home.
There's been lots of talk today about competition and the whole controversy over any willing provider. Do you think that's because people are finding it difficult to get to grips with, or because it's fundamentally against the NHS ethos?
I think the NHS does have problems with competition. It doesn't really go with the grain of a universal, comprehensive, publicly funded, planned healthcare system. Our view is there is a role for choice and competition, but that needs to go hand in hand with more collaborative, integrated models of care, where GPs work more closely with hospitals, for example, around the needs of people who've got chronic medical condition to better meet the needs of growing numbers of frail older people. And it's not inconsistent, we would argue, to see competition going ahead alongside collaboration, as long as the regulation of the healthcare market is done in the right way.
A lot of the things that you talk about are changes in the governance and accountability setup. Do you think that it is likely that this government is going to come up with something that the majority of clinicians are going to be happy with?
We very much hope the government will listen during the listening exercise and take account of people's concerns, and that is partly about governance, making sure that when the commissioning consortia are set up, it's not just a small group of GPs taking decisions. There are other clinicians and maybe representatives of the public and of patients too sitting around the boardroom table. We heard an example of that from Michael Dixon this morning. There are equally issues around the governance of foundation trusts. The government is expecting a great deal of the governors of foundation trusts in future to play a much bigger role in ensuring that they are well-managed organisations. We've been pointing out that's a very big ask of the governors, given their part-time nature and the variety of their backgrounds. So we would like to see foundation trust governance strengthened at the same time.
But with no top-down approach, isn't it likely that we're just going to end up with another example of patchiness in the NHS?
We believe there is a case for some central guidance. If you want to call that top-down, that's fine. We're talking here about the management of huge sums of public money, especially with the GP commissioning consortia, and you can't have a laissez-faire approach where every consortium works out its own approach without paying attention to the well-established principles of good corporate governance. So the government needs to recognise that and come out with a framework within which then the consortia can make their own local decisions.
The King's Fund have launched today a new tool which is going to help people. Explain to us what it is and how it will help them.
So our new report today is saying there's a real opportunity with GPs taking control of commissioning to focus on how we can improve services for patients. There's been too much debate, in our view, on the organisation of commissioning and too little discussion as to what it's intended to do. What are the ends that commissioning is intended to serve? That's what our report is all about. It's saying we need to use commissioning to really focus on how we can support more people to manage their own conditions. There's good evidence for self-management support. We think GPs too should be paying much more attention to how care is coordinated, particularly for people who've got complex conditions, because that will bring benefits. So there are 10 top tips for GP commissioners in our paper today, giving very practical examples supported by evidence of the early wins that GP commissioners can bring about if they read the report and use their powers to make change for the benefit of patients.
So we've got a bit of a hiatus at the moment. How would you like to see things progress in the near future?
I'm looking to the government to take this listening exercise very seriously. If it ends up simply with cosmetic changes, then I think that's the worst of all worlds. We need the listening exercise to result in substantial and significant improvements to the bill, improvements to the reform programme, including around governance, including around the phasing of the reforms, very much keeping in mind this ought to be about improving patient care, patient outcomes, and not just being focused on the mechanics and the organisation of healthcare. And not forgetting the key point that Stephen Dorrell and others have emphasised, the health service is entering a very challenging period financially. It's having to find up to £20 billion of efficiency savings. We must keep that in sight and ensure the new arrangements will help, not hinder, the delivery of that very ambitious, very challenging target.
Professor Chris Ham, thank you very much.